What is tennis elbow and how do you fix it? Hey folks, Dr. Jeff Williams here from Creekstone in Amarillo, Texas, and we're going to get into the weeds a little bit here on tennis elbow. You just have to stick with me. Now, what is tennis elbow exactly? It's that pain you're feeling on the outside of your elbow. It's commonly known as tennis elbow because they're always doing the backswing, right? And most people know that's the term for the spot and the pain. What most people don't necessarily know is why it hurts, or what they did to make it hurt, or how to get it to go away. I'm going to give you a brief education on the condition, also known as lateral epicondylalgia, and I'm going to give you some tips towards getting it to go away and leave you alone, hopefully. Symptoms of tennis elbow are pain over the outside part of the elbow, pain when extending the wrist, and pain upon movements that include gripping motions, right? So what causes tennis elbow exactly? Well, that's not a straightforward answer. Let's boil it down, though, to the simplest concept. It's pain where the muscle and the tendon attach to the bone on the outside of your elbow. The Mayo Clinic describes it as a painful condition that occurs when tendons in your elbow are overloaded, usually by repetitive motions of the wrist and arm. What that means is that they're saying it's simply an overuse issue. But can it be more than that? Did they get it exactly right? The research suggests that it's more than that and may not all be coming from the elbow joint and the tendon attachment alone. So think about it. Tissue has a healing time, right? When you break a bone, it's casted for about 6 to 8 weeks. When you have a muscle strain, 4 to 6 weeks, give or take. And then ligaments on the long end, they heal up 6 months or so. It may be a couple of years before somebody is completely normal, but for the most part, they're healing up in 4 to 6 months. So tissue has a healing time. And while some patients get out of pain and they recover, some just never do. Even when avoiding the use of joints, of the joint and the muscles in the area, even when they're avoiding, so if it's an overuse issue and they're avoiding the use of the joint, sometimes pain still persists. So this suggests that there may be a bigger, more neurological ingredient to the recipe. A couple of mentors of mine, Dr. Anthony Nicholson and Dr. Matthew Long, posed the question, could functional impairments in motor control, movement, in motor control and pain processing be present first, which then predispose the person to a mechanical injury from a trivial activity? Now, if this is the case, then it's possible that a person is in some way predetermined to suffer chronic lateral epicondylalgia before the elbow tendon even becomes painful. This is a very legitimate question, considering there's research suggesting that the trigger point found in the muscle began with the dysfunction within the brain before manifesting out peripherally as a trigger point in the muscle somewhere. The old idea of it being strictly one of overuse, an injury overuse, is looking more and more outdated these days. For example, it's known that there is abnormal collagen separation in patella tendons of athletes, yet they have zero pain. The same goes for non-painful tears of the rotator cuff mechanism in the shoulder. Now, knowing this, it seems unlikely that just collagen separation or damage is the pain generator, since the athletes don't have the same issue in the knee. Indeed, rather than an inflammatory overuse injury, it's looking more and more like it's a degenerative tendon insertion, that has a deranged structure which triggers the symptoms. Now let's add to the mix that long-lasting pain also in part resides in the central nervous system as well as in the elbow. Your central nervous system makes up your pain experience based on the actual source of your pain, your elbow, as well as a host of other factors, including but not limited to things you may have been told by other doctors. Oh, your body's fragile. You need to really be careful how you use that joint going into the future, takes that stuff in too. It takes in things that you may believe about yourself. I'm only 35 and I already hurt like this. What's my life going to look like when I'm 65? I don't think I'm ever going to be able to get out of pain. Right? It takes that stuff in to make up your pain experience. It takes in your physical abilities right now, today, your beliefs about being able to eventually recover and things of that nature. All of these factors and more combine to make up your total pain experience. Now it's starting to become more apparent that this is a non-inflammatory degenerative process of tendon insertion connected to a hyperexcited set of spinal cord circuits that themselves are not being dampened very well by areas of the brainstem, the areas that control pain, painful triggers, and whether that information is allowed into the noggin to actually cause you a painful experience. Now, I know we're getting a little deep into the weeds. I hope you're following along because it's all fascinating to me. Especially when you hear that based on studies by Berglund et al. And Vincent, you say that 3 times, Vincenzino et al., 90% of patients with tennis elbow also have some dysfunction in their neck region. Yeah, 90%. And 70% had neck and or mid-back pain. Wow, man, that is amazing, isn't it? Everything really is connected. There absolutely appears to be some connection between the neck and the upper back pain and tennis elbow, believe it or not. There are explanations for this, and I can walk you through this, but I'm going to spare you in this space here because the explanation gets very deep into the weeds, unless you're an expert in neurology. They'd get it. But trust me, a chiropractor can help through various forms of treatment focused at the elbow, but also in the neck and the upper back regions. Now, how do we treat tennis elbow exactly? Well, since the pain isn't typically just coming from the elbow joint, we want to increase healthy movement patterns in the whole chain from the neck region through the upper back into the shoulder and the elbow. And this helps remap the proper movement and functionality. Research by Fernandez-Carnero et al. Shows that spinal manipulative therapy, or going to the chiropractor, spinal manipulative therapy in the neck region had an immediate pain-relieving effect at the elbow and an immediate 38% reduction in pain from gripping. Wow! Immediate! So we want to do what we can to decrease chronic pain syndrome aspect of the complaint as well. And we do that through techniques that help desensitize the central nervous system that is dialed up to 11 on a scale of 1 to 10. And it's been allowing the pain to persist beyond the time it takes the tissue to heal up. We want to try to get it to just settle down, turn the dial down. Then we've got low-level laser, also known as cold laser. This technique is excellent at healing soft tissue injuries. Another possible consideration for something like this may be shockwave treatment, which is a newer modality that's just now really starting to increase in clinical use and popularity. Now, we involve the patient in active exercise, including eccentric exercise, to facilitate the repair of degenerative tendons. Dr. Nicholson says, it appears that collagen production is the key to successful recovery from the peripheral dimension of tendinosis. We know from animal experiments that eccentric loading improves tensile strength. So wrapping it up here, tennis elbow or lateral epicondylalgia is much more than an overuse injury. Some recover quickly. For those that do not, it is imperative to visit an evidence-based, patient-centered practitioner that knows what's going on and has techniques and tricks that can get the elbow to behave. The longer the condition is allowed to persist, the more difficult it becomes to eradicate. So be seen by a chiropractor today. See your expert today. Again, I'm Dr. Jeff Williams with Creekstone. If you're watching this on YouTube, comment, subscribe, and share, won't you? Because, you appreciate the information and you found value in it and you think others will too. If you're on Facebook, like, comment, and share because, the same reasons. If you're from the Amarillo area or you're going to be passing through and you'd like to be seen, call us at 806-355-3000. Let's get you on the schedule. I'd love to help you. Until next week, Take care. We'll see you then.